Hey guys, it's your girl Ariza, licensed clinical social work, test prep guru, your personal hype squad, whatever you want to call me. I'm helping you get those letters behind your name, all four of them. So this is the site you come to when you're trying to learn the strategy, the tools, and gain the confidence, the mindset, all of that stuff so you can level up and pass this exam. Today I have a special treat for you guys. Someone reached out to me and told me they really enjoyed my video on cluster B, personality disorder, when I did the breakdown of the Golden Girls, Blanche, and showed you how she was histrionic. Some of you probably like, what are you talking about? Yes, you need to check that video out because it would definitely give you an idea of how people look or present themselves when they have that diagnosis, which makes it easier for you to see it and recognize it on the test and say, aha, I learned that from LCSWVIBES. Yes. So anyways, today I got another video for you. And I'm going to go in explaining a little bit more about this personality disorder. Then we're going to show some footage from the video to see if it kind of makes sense and we can kind of reel it all in. So today we're hitting on cluster A personality disorders. These are those odd and eccentric folks. Often have that distorted thinking, some of that social withdrawal, and flat affect. Yes, I was trying to demonstrate it. I don't know if I did a good job. But anyways, today we're diving into schizoid personality disorder and how it shows up in this film called Lars and the Real Girl. It's a quiet but powerful story about connection, avoidance, and healing. I'm not going to show you the whole movie. I know you're going to only get a few minutes of it here and there, but I want you to see it. And if you want to know what the movie was, I had to give the movie props and tell you what the name of it was because honestly, I've never watched it all the way through, but it seems like it's a really good flick. So when it comes to the DSM-5 criteria for schizoid personality disorder, you have to have at least 4 specific traits out of 7. And I'm going to break that down and go into it. But first, let's look at a little bit of the video just so you can kind of get an idea of what this is about, what to expect, all of that good stuff. Let me share my screen and go ahead and show some of this video and see what you guys are thinking. If you're able to look at it and say, ooh, clearly that person has schizoid. So, as you can see really quickly in this video without, I don't want to do a whole lot of pausing, but I want you to see the next scene. But I just want to kind of go back a little bit and explain to you what that was. So you see this individual and he's looking out the door. He's obviously looking and he might have some type of interest in this female. However, individuals with schizoid personality disorder neither desire nor enjoy close relationships, even when it comes to family members. And they almost always choose doing things alone. So solitary activities. And these individuals have little, if any, interest in sexual experiences with other people. They take pleasure in very few things. And normally, if there are any type of activities, they're normally done with things by themselves. They also lack close friends or confidants other than maybe a first degree relative like a mom or a dad or a sibling. They also appear indifferent when they're given praise or given some type of criticism. And they normally show emotional coldness, a detachment, or some type of flattened affect. So those are the main 7 criteria that you will see in here. But let's look at Lars and let's just see which one of these symptoms or which part of these 7 criteria does he meet to see if he does have schizoid personality disorder. Let's resume. Are you studying for the LCSW or LMSW exam? Don't waste time on the wrong prep. Try my test prep program for free with a full module that gives you the real strategies, the real practice, and real results. Plus, you get access to my exclusive test prep community where you'll find support, study material, and accountability. No risk, no stress, just results. Click the link in the bio so you can get ready to win with the winning team. So pretty much that's the majority of the clip that I'm going to show you guys today. Of course, if you want to watch the movie, you can watch it in its entirety. But a little bit about the movie, just in case you don't decide to go and watch it. Some of the patterns that let us know that he met that criteria is that 1, he was isolated, living in a garage. He also avoided emotional closeness. You didn't really see any family, anyone around, just pretty much him living in that garage and the neighbor that was trying to seek him. Further in the movie, if you choose to watch it, he did have a delusional relationship with a doll. So it was kind of like his coping mechanism, something that he utilized to kind of like show that emotional detachment and comfort with fantasy versus reality. That's kind of what the doll demonstrated. And then also he always appeared emotionally flat or awkward whenever he was in these social interactions or situations. When he was at work, when he's talking to the neighbor, it's just a little difficult for him to appear like he's comfortable or to present like he's interested in the conversation at hand. Now, when you're talking about schizoid personality disorder, there are some other diagnoses that come up. You must understand there's a difference between that and avoidant. Avoidant, he doesn't seem too anxious about judgment and all that kind of stuff, so we're not moving him in that area. And he doesn't really seem like he has a fear of rejection. Those are the kind of things you see with avoidant. The autism spectrum disorder, and sometimes there are some overlaps with social detachment, but it's a little different because they're normally developmental markers and sensory features that you see with autism that you necessarily don't see with schizoid personality disorder. Now, schizoid and schizotypal are often confused by many when you're looking at it. I know when I was practicing for my exam, it took a lot for me to memorize the difference between someone that had schizoid personality disorder and someone that had schizotypal. Now, the difference here is that schizotypal personality includes that magical thinking or perceptual distortions, should I say. Like when you see these individuals, they have a certain thing, like they might wear a certain hat or something and feel like they can have another planet speaking to them. That's where that magical thinking comes in at. So you definitely want to be able to differentiate that from someone's schizotypal. And then also, as I shared earlier, when I was going over the characteristics of someone that has schizoid, they don't desire nor do they enjoy close relationships. So I always think of schizoid, like avoid, the OID part. However, individuals with schizotypal, they don't mind being around people. They're just awkward and they just have a difficult time connecting with people. So normally they are avoided by others versus the other one, they typically avoid other people versus you being avoided by them, if that makes sense. So schizoid, they normally do the avoiding, but schizotypal, the type of individual wants to connect with other people. They just have a difficult time doing so. So normally people avoid being around them because of their awkwardness, their magical thinking, and all of that stuff. So hopefully that makes sense for you guys. Keep in mind that when it comes to schizoid personality disorder, it is often underdiagnosed because a lot of people with this diagnosis don't seek treatment. They just figure like nothing's wrong. This is just who they are and how they are. And that is one of the personality disorders that people typically overlook or don't really notice or acknowledge. Now, because it's overlooked a lot and sometimes people are misdiagnosed or not diagnosed, there's a lack of treatment, so it's hard to treat these individuals because what are you treating? If the individual's not showing up, you're not able to see, you're not aware of certain things, you just figure this is just who they are and how they are. There's not a lot of treatment opportunities for them to seek treatment. And if they do, because of their lack of desire to connect or that lack of emotion or limited emotionality, is hard for them to connect. So imagine doing therapy with someone that has schizoid personality disorder. Some of you might have done that in the chat. Let me know. I'd love to hear how it went and some tools and suggestions that you've done, because me as a clinician, I've never really worked with anyone that had full-blown schizoid personality disorder. So I hope this video was really helpful. I just want you to take away and understand some of the important characteristics that you would see with the individual with schizoid personality disorder. Understand how they might engage with others and why they might look at it as being normal. Others might look at it as being abnormal, but this is just a part of who they are. So if you found this breakdown to be helpful, drop a comment in the comment section at the bottom and let me know some other films that you'd like me to analyze and help out with some mental health content. If this is your jam and you like it, because I watch a lot of shows and TV and I'm always looking at it with a clinical eye. So it's easy for me to get a movie and be able to look at characters and say, oh my God, he's clearly a narcissist. So, oh, wow, bipolar. I can look at that and see. So if you have some movies, some videos, some things that you've been thinking about or watching and you're like, I think they might have this, but I'm not sure, send it to your girl. I'd love to break it down. Make sure you invite a few people to watch this video and watch some of the other ones. Make sure you subscribe. Make sure you like all that good stuff. I just appreciate it. It keeps me motivated to keep these videos coming. Until the next one, you have an amazing day. And of course, go to the bio section and join the community. You thought I was going to forget about that? Join the community, baby, because we getting busy up in there, getting licensed while we at it.